Hi, everybody. Today we are discussing one of the most vital components of intrapartum care, fetal heart rate surveillance. As nurses, you are the eyes and ears for the fetus. While the patient is laboring, the monitor strip is the only way the fetus can talk to us and tell us how they are handling the stress of contractions. We are going to break down how to establish a baseline, how to assess the nervous system of the baby through variability, and finally, how to use the Veal-CHOP mnemonic to intervene when things go wrong. The foundation is baseline and variability. Before we can identify a problem, we must establish what is normal for our specific patient. The baseline fetal heart rate is the average rate rounded to increments of 5 beats per minute during a 10-minute segment. A normal baseline falls between 110 and 160 BPM. If we see a rate consistently above 160, we consider it tachycardia, which might suggest maternal fever or early hypoxia. Conversely, a rate below 110 is bradycardia, which can signal a more late-stage distress. However, the most important predictor of fetal oxygenation isn't actually the rate itself, it is the variability. Variability refers to the jaggedness of the line on the monitor, representing the constant tug of war between the sympathetic and parasympathetic nervous systems. We want to see moderate variability, which is a fluctuation of 6 to 25 BPM. This tells us the baby's brain is well oxygenated and the neurological system is intact. If the line becomes flat or absent, we are deeply concerned about fetal acidosis or extreme exhaustion. Moving on along, now let us understand what Veal-CHOP is. To help you memorize and react quickly in a high-stress environment, we use the acronym Veal-CHOP. This links the pattern we see on the monitor to the cause of that pattern. The V in Veal stands for variable decelerations, which are linked to the C in CHOP, standing for chord compression. These look like sharp, abrupt drops in the heart rate that often form a V, U, or W shape. They can happen at any time, regardless of when the contraction is occurring. When you see this, your first instinct should be position change. We need to move the mother to help the baby shift off the umbilical cord and restore blood flow. Next, we have the E, which stands for early decelerations, linked to the H for head compression. These are actually a reassuring sign in most cases. You will notice that an early mirrors the contraction perfectly. As the contraction starts, the heart rate begins to dip, and as the contraction ends, the heart rate returns to baseline. This happens because the baby's head is being squeezed as it moves down the birth canal, stimulating the vagus nerve. Generally, no intervention is needed here other than documenting the progress of labor. The A stands for accelerations, which are linked to the O, meaning OK, oxygenated. An acceleration is a temporary increase in the heart rate, specifically 15 beats above the baseline for at least 15 seconds. This is exactly what we want to see. It means the baby is reactive and has plenty of oxygen reserves. It's the fetal equivalent of a thumbs up from the womb. Finally, the critical warning one is the late decelerations. This is the most concerning pattern, the L for late decelerations, which is linked to the P for placental insufficiency. These are subtle and dangerous. Unlike an early deceleration, a late starts after the peak of the contraction and does not return to the baseline until well after the contraction has finished. This timing gap tells us that the placenta is struggling to provide enough oxygen during the peak of the contraction and the baby is taking a long time to recover. This is a nursing emergency. You must implement intrauterine resuscitation immediately. Turn the patient onto her left side to maximize blood flow, bolus full fluids to increase maternal blood pressure, apply oxygen at 10L via a non-rebreather mask, and stop any Pitocin that might be causing too many contractions and prepare for possible expedited delivery if unresolved conclusion for the class. Remember, your goal isn't just to memorize the acronym, but to understand the why behind it. If the cord is compressed, we move the mom. If the placenta is failing, we provide oxygen and fluids. You are the interpreter of that monitor strip. Use it to ensure every baby has a safe path to their first breath. Homework. A nurse looks at the monitor and sees a variable deceleration, a sharp V shape. Based on Veal-CHOP, what is the very first thing the nurse should do for the patient and why? Drop your answer in the comment section below.